Hi, my name is Erica Duncan. I am a health administration major.
I'm Emily Shoemaker, School Health and Health Administration.
Caitlin Clancy, Community Health. Our program is Boston Underage Sobriety Team, or BUS.
According to the CDC, alcohol is the most commonly used and abused drug among youth in the United States. In 2009, the Monitoring for Future survey reported that 37% of 8th graders had tried alcohol, and according to the Boston Public Health Commissioners, 34% of the Boston Public Schools aged 15 and younger reported drinking alcohol in 2009. The Healthy People 2020 objectives used were substance abuse 2.1, increase the proportions of at-risk adolescents aged 12 to 17 who in the past refrained from using alcohol for the first time, early and middle childhood 2.2, increase the proportions of parents who use positive communication with their child, and educational community-based program 2.5, increase the proportion of schools that provide comprehensive school health education to prevent health issues such as alcohol abuse. Based on the information provided in the Healthy People 2020 objectives and the National Health Education Standards, the purpose of BUS is to increase preventative behaviors, knowledge, and awareness of underage drinking in the Boston community. Our goal is to reduce the prevalence of underage drinking among middle-aged youth in the Boston Public Schools.
As we mentioned in our statement of need, the statistics provide evidence that students between the ages of 10 to 14, those in 6th through 8th grade, are associated with alcohol consumption. According to the Boston Public Health Commission, 4 in 10 Boston Public High School students reported drinking alcohol within the past month. Therefore, we chose middle school youth as our primary target market because we want to prevent underage drinking by providing knowledge and skills so they have the necessary tools to avoid alcohol use before entering high school. The socio-ecological model, or SEM, is a framework for prevention, which is the ultimate purpose and goal of BUST. This model considers a complex interplay between individual, relationship, community, and societal factors. It allows us to address the factors and put people at risk for underage drinking. Our program specifically addresses individual and relationship level of SEM. At the individual level of the socio-ecological model identifies biological and personal history factors that are uncontrollable factors among middle-aged school youth. Since the students at this age are beginning their decision-making, our prevention strategies are designed to promote attitudes, beliefs, and behaviors, factors in which they can control that ultimately prevent alcohol consumption. Our secondary audience includes the community, families, and stakeholders such as the mayor, principals, superintendents, and teachers, all whom tie into the relationship level of the SEM because they have a considerable influence of alcohol use.
Now we will discuss how our primary and secondary audience fit into our marketing plan while introducing the 4 Ps, beginning with place. There are 9 middle schools in the Boston Public School System that consists of 6th through 8th grade. Our pilot program focuses on Timothy Middle School in Roxbury, Massachusetts. The program will take place in the classrooms, auditorium, and possibly outside if the weather permits. Before we discuss our product, it is essential to elaborate on the diversity of the Boston Public Schools because it is a major factor in the design of our program. According to the CDC, Boston Public School demographics from 2010 to 2011, 41% of the population was Hispanic, 36% Black, 13% white, 9% Asian, and 2% were multicultural. Among these students, 45% speak a language other than English as their first language, 30% are limited English proficient or English language learners. So as you can see, we are working with a uniquely diverse community, and our program efforts are based off these cultural differences.
For our product, our campaign and advocacy program is to bust through alcohol use, a full day filled with alcohol training and skill building through fun activities. It will take place during the month of April, which is Alcohol Awareness Month. Bilingual educators and resources will be available in the various languages to tailor to the diversity represented at Timothy and other Boston public schools. Our program also adheres to a variety of learning styles, such as auditory, visual, and kinesthetic, so all students can benefit from the information provided. Each grade will have its own week, and for the 4th week of April, our program will come together and bring everyone together for a final awareness week. The students will be allowed to dress down this week instead of wearing their school uniforms and will be encouraged to wear the t-shirts that they designed during the program on Friday. Now, for the specifics of the program. Every one of the 9 activities addresses either the individual or relationship level of the SEM or a combination of both. We will first begin with the activities that emphasize on the individual's beliefs, attitudes, and behaviors. First, we have our introduction, What's the News on Booze, which will be conducted by our program director and will give information about the program and about alcohol. Then we have our guest speaker, former Boston Celtics player Vin Baker, who lost it all to alcoholism and now reaches out to the youth with his Stand Tall Foundation. Then we have our simulation activity with beer goggles. And our advocates from Simmons, who we already have a partnership with, and other colleges and universities of volunteers and interns who we will be training prior to the program will give students activities to do while under the influence. Then we have alcohol's effects, where our nurse practitioner and our health educator from our school-based health center in Madison Park High School in Roxbury, Massachusetts, will talk about the physical, emotional, mental, and social effects of alcohol use, more specifically addressing unplanned pregnancy, unprotected sex, injuries, death, and tobacco use. There is one activity that specifically addresses and reaches middle schoolers at the interpersonal and relationship level of the SEM. This is our skits or role-playing No Means No. It allows students to practice and build personal refusal skills in their native language and English to help reduce the influence of peer pressure or peer circles. The rest of these activities incorporate both the individual and relationship levels. One major aspect of our program is our BUST website. We will teach students how to register and navigate the computer and mobile app versions. This allows students to privately let out feelings of pressure or problems related to alcohol use, and we'll also provide useful information, tools, links, podcasts, etc. Our 24/7 text messaging system also gives students direct access for alcohol questions or issues and to talk to someone without the fear of using a school or family computer. We will utilize Google Analytics to determine which aspects of our website are most beneficial and interesting to the students. Then we have our Ways to Bust Alcohol Use, which is our interactive kinesthetic learning. We'll use modeling to show students that participation in other activities such as sports, arts and crafts, or hobbies can be ways to prevent alcohol use by themselves, with their friends, or with their family. Then we have our t-shirt design, How Do You Bust Alcohol? Students can design the front of our campaign shirts and are encouraged to be creative and come up with their own slogans, mottos, or ideas to prevent alcohol use and ways to say no in whichever language they prefer. Then we'll have our closure or in our wrap-up where we will bring the students in small groups and they will have a chance to reflect on the day, ask any questions, and this is also when we will distribute our first post-test for assessment and evaluation.
For promotion, the BUST team will email and mail with the school logo for enhanced our credibility. Press release, local newspapers, social media, Facebook, Twitter, websites, BUST, Boston Public Health Commission, Boston Public Schools, individual school websites, information packets for the parents, gift bags, raffles for the students, 9 Roxbury YMCA 1 family memberships.
Then we have our price. It'll be free to students and parents, but we had a grand total including indirect cost of $63,004.70. We had in-kind services of $21,300 and a hard match from our grants of $58,000, which we feel this is enough and it is renewable and will provide financial stability and sustainability for our program. The Sober Truth on Preventing Underage Drinking Act is $50,000 and prevents and reduces alcohol use among youth aged 12 to 20 in the U.S. Then we have the Christopher D. Smithers Foundation grant, which is $3,000 and focuses in the field of alcoholism prevention and education. And then we have our Greater Boston Council on Alcoholism grant, which is $5,000 and supports programs that focus on education and prevention for children. So the total amount requested after a hard match is $5,004.70.
Along with the socio-ecological model, we incorporate the health belief model in the design of our program and prevention strategies. This prevention is based on the belief that health-related actions depend on the simultaneous occurrence of 4 different factors. The first factor being a person must believe that his or her future health is in jeopardy, and a person must feel that they are at risk for drinking underage. The second factor is a person perceives the potential seriousness of underage drinking in middle school. The third factor is a person assesses that the benefits of the behavior outweigh the cost of the behavior. Lastly, the person perceives acute action that makes the person feel that the need to take action will occur at the start of the BUS program and continue after the completion of the program.
For our evaluation of our program, we had a process, impact, and outcome. For our process, our classroom teachers will distribute pre-program surveys 6 months prior to the program to assess the students' prior knowledge, behaviors, and attitudes towards alcohol use. And typically, the highest rate of return for surveys is 30%, but since we'll be distributing the surveys in school and have an affiliation with the school, we can expect a higher rate of return because of increased perceived credibility. Parents are more likely to allow their students to participate because it will ultimately benefit their children. Our program will also be based on these survey responses and will be specifically tailored to each grade level. For our impact, our survey will also be given after the day's events and after the program is complete to measure the level of awareness and education. Also, 20% of the Boston Public Schools is in grades 6 through 8. And according to Dr. Everett Rogers' diffusion of innovation theory, we know functionally only 84% of this population is going to be receptive to change, which means, in reality, 16% of this population, or the laggards, are never going to change because they don't care, they're not interested, or they're already using alcohol and don't see the benefits in stopping. We are confident that with this program we can reach the early and late adopters, which will be our majority.
In regards to the outcome, there are major difficulties in how we assess if behavior changes are taking place. There will be surveys given 5 months and again 1 year after the program to assess and measure level of behavior change, awareness, and education. By the end of the BUS pilot program, there will be a 35% increase in students' knowledge, awareness, and preventative behaviors of alcohol drinking in Timothy Middle School. 5 years after the pilot program, incidents of alcohol among minors in the Boston Public Schools will have decreased by 25% as assessed through the epidemiological statistics.
To conclude, while we feel confident that our pilot program can be sustainable and will make a positive and significant impact at the individual and interpersonal levels, in order to reach the youth of Boston at the community and societal levels, we would need to consider a phase 2. Middle schoolers and high schoolers cannot completely control some of their risk factors for alcohol use because alcohol use may be ingrained into their society or culture. We need to collect a baseline assessment through surveys and focus groups among community members, our stakeholders, and parents to gather information from multiple perspectives. We wanted to make an impact and difference in the schools through our BUST prevention program. However, the school environment and students' behaviors are often a reflection of behaviors, attitudes, and knowledge of the community and society's norms as a whole. Therefore, to fully impact the youth of Boston and to reduce underage drinking at the community and societal levels of the socioeconomic model, more qualitative and quantitative research that specifically addresses alcohol use among the community needs to be conducted.